Today, we are jumping into a medical mystery that had doctors totally stumped for years. It's the story of a young boy who was tormented by this painful recurring rash. And the solution? Well, it turns out it was hiding in plain sight the entire time.
I know, it sounds like something straight out of a movie, right? But this story is 100% real. It's all about a mystery that went on for years and was solved, not with some high-tech procedure, but with one simple, fundamental.
All right, so let's set the scene. Our story centers on a 6-year-old boy from a rural part of Chhattisgarh in India. And from the time he was just a baby, pretty much his entire life, he was caught in this just awful, painful cycle.
Imagine this. He had these terrible, crusted sores all over his body. His arms, his legs, his face. And, the doctors would give him treatments, and for a little while, things would get better. There'd be a glimmer of hope. But that hope, it never lasted. The painful rash always came back.
So this case was a real puzzle for everyone. But then, everything changed. A specialist, a dermatologist named Dr. Ravi Shankar Dwivedi, was brought in to take a look. And for him, the most important piece of evidence, the absolute key, was hiding in plain sight in the pictures of the rash itself.
And this really gets to the core of how this doctor thought. For him, dermatology is all about what you can see. He believed the answer was right there, you just had to know how to look. The specific pattern of that rash wasn't just a random symptom, it was a message, a visual clue pointing directly to the real problem.
And wow, does this show you the power of a trained eye. Just by looking at photos, he knew something was up. He had this strong suspicion because the rash had a very specific pattern. It was around the mouth, on the hands and feet, and that pattern didn't just suggest, it screamed that this was something way more specific than your average skin infection.
So, with this huge visual clue in mind, what do you do next? Well, he didn't go crazy ordering a ton of expensive, complicated tests. Nope, he ordered just one. Any guesses what it was? He tested the boy's serum zinc level, and the result was just staggering. It wasn't low, it was undetectable, gone. His body had basically zero circulating zinc. And zinc, you have to understand, is an absolutely essential micronutrient for life.
So with that one test result, boom, mystery solved. And you know what's just as incredible? The cure was as simple as the diagnosis was, well, profound. A life was about to be completely transformed.
Think about it. No crazy drugs, no surgery or invasive procedures, just an oral zinc supplement. The kind of thing you or I could pick up at a local pharmacy.
And the change, it wasn't slow. We're not talking months or even weeks of waiting. Get this, after an entire childhood of pain, a real, visible change happened in just 7 days.
It was described as nothing short of dramatic. Those horrible, crusted lesions that had been a constant in his life, they were finally healing. The nightmare cycle was finally broken.
So what was it? The official diagnosis is Acrodermatitis Enteropathica, or AE for short. It's this rare genetic thing. Basically, there's a tiny glitch in a single gene, and that gene's job is to build the little gatekeeper that lets zinc from your food get into your body. If that gate is broken, it doesn't matter how much zinc you eat, you're basically starving for it.
Okay, so now that we've seen just how dramatic this can be, let's dig in a little deeper. What exactly is Acrodermatitis Enteropathica, and what are the telltale signs that doctors look for?
Well, when doctors are on the lookout for AE, they're taught to search for a very specific combo of 3 symptoms. It's called the classical triad, and it's kind of like a diagnostic fingerprint for this disease.
So what's in this triad? First, you've got alopecia, that's hair loss. Second, diarrhea. And third, you guessed it, that very unique rash, especially around the mouth and on the hands and feet, exactly like the boy in our story had. If a doctor sees those 3 things together, big red flags should be going up.
And here's another huge clue: when it shows up. If a baby is on formula, the signs appear pretty early on. But if a baby is breastfed, they might seem perfectly fine until they stop breastfeeding. Why? Because they were getting just enough zinc from their mother's milk to get by.
All right, so let's say a doctor thinks they might be looking at a case of AE. What's the game plan? Well, the good news is it's actually a really clear, logical process. It's a simple 3-step framework. Step 1, evaluate. You're looking for that classic triad of symptoms we just talked about. Step 2, investigate. That's where you order that super important zinc level test. And step 3, treat. You start zinc supplements, and for someone with this genetic condition, that's a for-life thing.
Now, it's really important to know there's a difference here. The inherited kind, AE, is the one that needs lifelong zinc. But you can also have an acquired zinc deficiency, maybe from a poor diet or some other health issue. And in that case, the treatment might just be temporary.
And really, this whole case just hammers home the main lesson. Sometimes the most complicated, confusing medical problems come down to something incredibly simple. It's a powerful reminder of how a tiny little micronutrient can be a total game changer. And believe me, zinc is a powerhouse.
I mean, look at all the jobs it has. Zinc is a crucial part of more than 200 different enzymes in your body. It helps run your metabolism, it's a cornerstone of your immune system, and as we've definitely seen, it is absolutely non-negotiable for healthy skin and healing.
Which brings us to this quote from the doctor who cracked the case, and it just sums it all up perfectly, doesn't it? This wasn't some futuristic high-tech procedure. It was about seeing a basic, fundamental need and meeting it with a simple solution that turned a child's entire world around.
This story is just such a powerful lesson, isn't it? To always look for the simple answer that might be staring you right in the face. And it really makes you wonder what other big, complicated problems out there in medicine or, just in life are just waiting for a simple solution that we've all